endocrinology literature. So most of what I'm going to be talking is from the world of neurology and psychiatry. So you could call this as a neuroendocrinology of lust. And this also made me realize maybe I should write this up as a paper because, there's nothing really spoken in terms of the endocrinology or the neurohormonal or hormonal regulation of lust that we see in our patients. So I will be telling kuti stories along my presentation to sort of make this easy to understand. I have no conflict of interest for this presentation this afternoon. So when we define lust, predominantly we define lust from a sexual context. So this is a strong craving for sexual activity. முக்காவாசி அப்படிதான் we define, driven by physical attraction rather than an emotional connection. So when we have this emotional connection, it's love, it's attachment. Anga vera hormones play a role, oxytocin and vasopressin play a role, like what Dr. Aruna just presented, the happy hormones play a role. But metaphorically, lust can also be anything, the lust for reading, lust for cooking, lust for money, power, enna venama irukkalam. But the presentation today is primarily going to be talking on the sexual lust and how do we sort of define this from the neuroendocrinology angle is what I will be talking for the next 15 minutes or so. So when we talk about the different definition, lust is a strong sexual attraction, often short term, or attachment irukadu. But love is a deep, multifaceted emotional attachment which is enduring and nurturing. Again, there are different hormones that play a role there. Hypersexuality, last year in the same conference here, Dr. Prem Kumar presented an excellent presentation on hypersexuality. That is a problematic sexual behavior needing attention. It impairs the life. That's, again, there could be some crossroads between all these things, but this is how we define them. And desire is more like an umbrella term. So some of the mythological stories or the Greek stories that we see can be love, lust, ellame konjam interplay of different things irukkalam. So desire is more broad and it can motivate anything from a sexual activity to an emotional connection. So if you have to define this is how we define love, lust, hypersexuality and desire. So here, being in Madurai, I can't really not talk about this. We all know the story of Kovalan, Madhavi, Kannagi story, right? So here, the Kovalan's love for Madhavi here is she's celebrated for her beauty. So he just gets married to Kannagi and he leaves Kannagi and, he goes, for Madhavi here. This act is often characterized by sexual desire or lust. Ipdidan Ilango Adigalar describes this in his book, right? Silapadikaratla apdidan avar describe pandrar that he is drawn by the physical and emotional attraction rather than an enduring affection. And after a few years, I think the literature says about a year or 3, he comes back again to Kannagi, and then we know what happened with Kannagi and the king and how she burnt Madurai, and that story is different. But here again, Kovalan's attraction here is depicted as a temporary infatuation of lust, not built on deep emotional connection. That's how the literature talks about when Ilango Adigalar describes about Kovalan's attraction for Madhavi. And I want you to also think about another story here, story of Ahalya and Indra, from a male perspective here. I will come back to the story. So we have all read about this story in Ramayana. Idhile nariya versions irukku, like where they say that, Ahalya didn't know that Indra came as Gautama, and his basic desire was to make love to Ahalya, because Ahalya was so beautiful. Love at first sight, Madhuri. Not love, it was not actually love. It was the lust, He just wanted to have a sexual intercourse with her, make love to Ahalya. So that was the primary intention of Indra. So he disguises, and he comes as Indra's husband, Gautama, sage Gautama, and then he makes love to Indra. Idhile Ramayanathile nariya versions irukku where Indra, they say that Ahalya didn't know about this, where Ahalya knew about this, and the mari nariya versions irukku. But we will talk from a male perspective in the next few slides. But if you specifically look at the functional MRI tracing of love, it's completely different nucleus that sort of highlights. Here, in between love, mostly it's nuclear accumbens and ventral pallidum and the ventral tegmental area that sort of highlights in the functional MRI. But if you look at the lustful area, the regions and the roles in the functional MRI, it's completely the limbic system and the reward system that gets activated in the functional MRI. You see the hypothalamus, the posterior insula, amygdala, the anterior cingulate cortex, orbitofrontal cortex, all these things are the areas that light up in the functional MRI, showing it's completely different from people who are in love to indifferent in people who are in lust. And we will come back to the same Ahalya story. Here, the attraction or the sight, it could be thought, or it could be a sexual fantasy, or it could just be a smell, that could sort of trigger the hypothalamus. This exactly would have what happened in Indra's brain. We are talking here this afternoon today. So all the sight of Ahalya and how beautiful she was, Brahma made her very, very beautiful. That's how they describe Ahalya's beauty in Ramayana. That triggers hypothalamus, and hypothalamus tells the VTA, let's just get excited. அதே சமயத்தில் hypothalamus also has this testosterone secretion. Testosterone is what is important for both male and female lust. I'll also tell this story from a female perspective. Adiliyum pathina, the testosterone is the hormone that plays a very important role. And at the same time, the VTA releases dopamine to the nucleus accumbens. And here you have this mixture of different neurotransmitters that come into play. The amygdala adds the emotional intensity. The norepinephrine induces the arousal and alertness. That's what happens when we are when we make love. And opioids from noradrenaline heightens the pressure. And you add the serotonin and the glutamate that sort of fine-tunes the mood. This is exactly what happens at the brain level, from not just from the functional MRI tracing, but from the neurotransmitters and the hormone level, because it's hard to tease out. Verum testosterone mattum pesa mudiyadu, because this is a crossroad of neurotransmitters that happens at the brain, and also the testosterone, which plays a very, very important role in the lustful behavior. And these are the brain regions that gets involved in lust. So sort of showing you a complex pathway that happens at the brain when we actually, read about lust. And if you look from a female perspective, you can tell another story, Shurpanaka's story from, idile nariya angles irukku. But if you look at Shurpanaka, like she has this lust towards Rama first. And then she approaches Rama and says, I like you, I want to get married to you. Appa Ramar solrar, no, I'm already married to Sita. So again, there it's monogamy. Ramar is monogamous, right? Anga, the hormone that plays a very important role is vasopressin. Vasopressin is a monogamous hormone. It has been studied in a lot of mice, California rodents. They all mate with only one pair for the rest, throughout their life, until only if the partner dies, they go for another mating partner. So this behavior, this hormone vasopressin, is also studied extensively in the rodent and animal models. So Ramar, being monogamous, says, I'm already married to Sita. I'm not going to look at you. You can approach my brother Lakshmana. And then she goes to instantaneously, apde Ramarlende, she moves to Lakshmana. So this here, testosterone again is a principal hormone that's associated with libido and aggressive sexual behavior in all sexes, including female. When we see this from a female perspective, adiliyum we think about estrogen. Of course, estrogen still plays a very important role in sexual receptivity. Estrogen is again very complex. Both in male lust and female lust, estrogen is quite complex here. So if you look at the estrogen, sexual receptivity, motivation, and the physical manifestation of sexual arousal, estrogen plays a role. Of course, there is a role for progesterone also. That's why, our mood and our sexual behaviors change within ovulation. So when we have this heightened sexual arousal during the ovulation time, and just before the menstrual cycle, when we have this premenstrual syndrome, we are not very inclined for a sexual intercourse with our partner, or, that progesterone also plays a role. But the primary hormone that is sort of important when we talk about the lust behavior in both men and women is testosterone. That is the primary hormone. Again, that is what could have happened here, because the testosterone receptor in hypothalamus improves the libido. It makes also the serotonin level go down. It suppresses serotonin level, which reduces the aggressiveness that we see. So testosterone here plays a very significant role in male and female lustful behavior. So if you have to translate this from the mythological story to a hormone, how do we do this? Her open expression for lust, to both Ramar and Lakshmanar, could be testosterone and dopamine-mediated enhancement of libido that we see. And the impulsive approach and the rejection shift. So she's rejected by Ramar, and when she goes to Lakshmana, can be dopamine-fueled risk-taking with low serotonin restraint. So again, there's a complex hormonal interplay that happens in our brain, which sort of makes her approach, and rest of the Ramayana story we know. I'm not going to talk about that. But this is exactly what I want to highlight from a hormone perspective from the women angle as well. So if you look, to summarize here, if you have to talk about lust, it's testosterone and estrogen that drives pure sexual desire and physical attraction. And dopamine and norepinephrine from the neurotransmitters helps with the euphoria, the craving, the energy that we have during the, the love making, and the attachment. Some of the lust could have a long-term relationship as well. Anga the oxytocin and vasopressin comes to play. Oxytocin is also called as a cuddle hormone, right? So here it helps with bonding and long-term stability and intimacy. So this is how the hormone sort of differs between love and attachment and sort of a lusty behavior. So the next question that comes is, lust tappa, is lust bad? Why are we talking about this, right? No, lust is not bad. There is always a thin line, right? We know who this is, right? Kama. Kama is recognized as one of the 4 purusharthas. After dharma, prosperity, moksha, Kama is also required in life. And we know the story of how Kama played an important role in Shiva and Parvati having Murugar, right? So you need Kama for procreation, right? So it's accepted as a vital, natural force that when this is balanced within the moral and social framework, you can have joy, creativity, and procreation. So it is important. So I wouldn't say lust is bad. How balanced this is from the moral and social framework is what is important, from the societal angle. Again, you can have positive and negative consequence. From a biological or a psychiatric perspective, it drives reproduction, intimacy, overall, having an attraction, having sexual intercourse or a love making definitely improves the mental well-being. There's no doubt. But how you do it depends, can also lead to risky behavior, addiction, distress, hypersexuality comes to play where you really need therapy. So again, there is a thin line, and that's exactly what we really need to. So this is true from biological perspective or a social, cultural perspective or a mythological perspective. There are a lot of Greek stories, a lot of Indian stories that we can talk about these things. I'm sure a lot of you would have come across stories that you've read, and probably you can connect this with this talk today. And definitely there are positive and negative consequences to lust. So from coming to a medical point of view, we're in a medical conference, enough of a lot of the stories and sort of correlating the hormones with these stories. If you have to look at the causes of the lust, most common thing is neurochemical imbalance. Whatever the hormones that we talked about in terms of neurotransmitters, adhula edavadhu imbalance irukkalam. So this could probably be one of the cause for this lust. Brain injuries, any traumatic brain accidents, Parkinson's, dementia, leading to disinhibitions can be. This is something very commonly we see in patients with dementia. Hormonal influence, testosterone. Sometimes in female hyposexual drive, or patients with hypopituitarism, we will start them on, testosterone replacement. That's where we really need to sort of start low and build it up. I use a lot of testosterone for my gender affirming therapy as well. I use it as a cross-sex hormones for, for my female to male patients who are undergoing transgender care. So Angyu, we have, every time I usually ask them about this, but this is important that, how we started, it can suddenly increase the drive, the behaviors. So that is very important to counsel our patients as well. And the prenatal androgen exposure has been talked as one of the causes why we have this sort of a gender identification, or how some people identify them as male, and all those things have been talked about, the prenatal androgen exposure that modulates the sex drive. It can be a part of psychiatric illness, bipolar, depression, anxiety, substance abuse, very common. In terms of psychological trauma, it's very important. They could have gone through a sexual abuse as a child. That's where needing a good psychiatrist and a therapist, very important. Environmentally, easy access to sexual materials. That's very common. So adanaliyum we see this increased behaviors, which is very important. Medication side effect. Romba common Parkinson's patient varumbodhu, the neurologist would probably see this, and sometimes they would need co-management with a psychiatrist as well. Dopamine agonist can sometimes cause compulsive sexual behaviors, both in male and female Parkinson's. So it's very important that we need to keep that in mind as a medication. So these could be common for the common reasons for lust. In terms of diagnosis, Mukavasi diagnosis is from the psychiatric world. Of course, we'll get a history. We might do a hormone evaluation, but most of the time, of course, in patients we are replacing, we can adjust the dose of testosterone therapy or start low and go high. But majority of this is diagnosed from a psychiatrist or psychologist perspective. They also have something called as lust scale. Lust scoring scale known as being standardized, where they get few questions and then they see how to diagnose patients. There are formal diagnostic scales that are available to identify these behaviors. and treat them. In terms of management, most of this is psychotherapy, managing urges, changing behavior, psychodynamic therapy. So a psychologist and a good psychiatric care is very important. In terms of medication, again, SSRIs, mood stabilizers, anti-androgens can be considered. There are support group, Alcohol Anonymous irukra madri, Sex Addicts Anonymous irukku. It's the most from a hypersexuality perspective. But again, support groups are available for treatment and addressing the comorbidities in terms of, say, bipolar or depression or anxiety. அதெல்லாமும் ட்ரீட் பண்ணணும். ஸோ this is the overall sort of management perspective for patients. So I will finish with this slide here. So I've given you an overview from, not just from the hormone perspective, from a functional MRI perspective and the neuroendocrine perspective of what happens in lust and how it's different from love. And we also talked about the causes and the therapy for the lustful behavior. So I will finish with this Tirukural here. Malarinum mellidu kamam silaradan sevi thalaipaduvar. Lust is more delicate than a flower. Only a few understand its true nature and enjoy it rightfully. So as I said, there's a very thin line. So how we do practice is very important. With this, I finish. Thank you.